Look at your hands right now. Not your nails, your hands. The skin between your fingers, the firmness of your grip. Whether your knuckles look swollen in the morning, whether there are small bruises on your forearms you do not remember getting. Now think about the last time you told yourself, that is just age. Margaret was 72 years old, a retired emergency room nurse from Sacramento, California. She had spent 30 years recognizing signs of illness in other people's bodies, and for 3 years she had been systematically dismissing the signs in her own. Leg cramps that woke her at 2 a.m. 2 or 3 nights a week, skin that felt perpetually dry and tight around her nose and forehead, regardless of how much moisturizer she applied, a persistent low-level fatigue that no amount of sleep resolved, and for 8 months, a tingling sensation in both feet. She described it as walking on sand that was not there. Her primary care physician had told her these were expected changes for someone her age. "You're 72, he said. "This is what 72 feels like." Margaret came to see me not because she believed something was wrong. She had accepted his assessment. She came because her daughter had insisted. Every single one of Margaret's symptoms had a specific, testable, correctable nutritional cause. None of them were aging, and the tingling in her feet, the one she had almost stopped mentioning because doctors seemed least interested in it, was the most medically urgent of all 4. I am going to walk you through 8 signals exactly like Margaret's. Signals that have been labeled normal aging in millions of Americans over 60. Signals that are, in reality, your body's very precise request for a specific nutrient it is not receiving. And I will show you how to tell the difference, sign by sign, mechanism by mechanism, with the study that proves each connection. My name is Dr. Chandler. I specialize in gerontology and age-related disease prevention, specifically the physiological changes that occur after 60, and which of those changes are genuinely unavoidable versus which are the predictable, measurable consequence of specific nutritional insufficiencies that compound quietly over decades. Here is the clinical reality that most standard appointments cannot accommodate. After 60, 2 parallel processes accelerate simultaneously. Your body's ability to absorb nutrients from food decreases due to reduced stomach acid production, slower gastrointestinal transit, and declining enzyme activity. And your body's requirement for specific nutrients actually increases. To maintain muscle mass, bone density, immune function, and neurological integrity, a 2017 review in the American Journal of Clinical Nutrition documented that adults over 65 absorb vitamin B12 at approximately 40% the rate of younger adults, absorb magnesium at 30% lower efficiency, and have significantly impaired conversion of dietary precursors to active vitamin D. The authors identified the 60-plus population as systematically at risk for subclinical deficiency across multiple nutrients simultaneously, even when dietary intake appears adequate on paper. Stay with me through to the end, because sign number 8, the one Margaret almost never mentioned because it seemed least important, is the sign most consistently mislabeled in Americans over 60 and the one with the most serious long-term neurological consequence if left unaddressed. I will tell you exactly what to ask your physician to test and why timing matters. Here's what I need you to understand about the stakes of this conversation. The word aging is doing enormous clinical damage in this country, not because aging is not real, it is, but because it has become a diagnostic endpoint rather than a starting point. When a physician tells a 68-year-old that fatigue, muscle cramps, dry skin, and reduced coordination are expected for their age, that physician has closed the investigation. The patient accepts the conclusion, and the actual correctable cause continues unchecked for months or years. Here is what I need you to do while you watch this video. Scan yourself. Each of the 8 signals I'm about to describe has 3 levels. Observe, monitor, and act today. Observe means photograph and document, monitor for change over 4 weeks. Monitor means raise it at your next scheduled appointment and request the specific blood test I name. Act today means call your physician this week. This finding requires evaluation before your next scheduled visit. Sign number 1, Skin flaking around the nose. Not dryness, a fatty acid imbalance. Urgency level, observe. Think of the membrane of every skin cell as a balloon made of fat. The type of fat determines how flexible that balloon is. Omega-3 fats make it stretch without cracking. Too much omega-6 without enough omega-3 makes it rigid and brittle. The flaking you see is the surface expression of membrane rigidity happening in millions of cells simultaneously. If you have noticed persistent dry, white, or slightly yellowish flaking, specifically around the nose, the eyebrows, or the sides of the forehead, and moisturizer relieves it temporarily but does not resolve it. This is not a skincare problem. It is an essential fatty acid imbalance. Your body requires both omega-3 and omega-6 fatty acids. The modern American diet delivers approximately 15 to 20 times more omega-6 than omega-3, largely through vegetable oils, packaged foods, and restaurant cooking. This imbalance suppresses the anti-inflammatory pathways that maintain skin barrier integrity. The correction: reducing cooking oils high in omega-6, corn, soy, canola, sunflower, and adding 2 to 3 servings per week of fatty fish, salmon, mackerel, sardines, or 1 tablespoon of high-quality fish oil daily. Most people see visible improvement within 4 to 6 weeks. The next sign is one almost everyone over 60 has experienced at least once, and almost no one connects to a nutritional cause. Sign number 2, nighttime leg cramps, blamed on circulation caused by magnesium. Urgency level, observe. Muscle contraction and relaxation work like a biological door hinge. Calcium is the spring that slams the door shut, triggering the muscle to contract. Magnesium is the damper that eases it back open, allowing the muscle to fully relax. Without enough magnesium, muscles contract normally but release incompletely. A cramp is a muscle that closed but cannot fully open again. Waking up at 2 or 3 a.m. with a sudden, severe calf cramp is one of the most common sleep disruptions reported by adults over 60. It is almost universally attributed to poor circulation or dehydration. In the majority of cases, the primary driver is magnesium insufficiency. After 60, magnesium absorption from the gut decreases by approximately 30% compared to younger adults. And magnesium is simultaneously depleted by the most common medications prescribed to this age group: proton pump inhibitors for acid reflux, diuretics for blood pressure, and metformin for blood sugar, all of which increase urinary magnesium excretion. A 2021 review in Magnesium Research estimated that up to 45% of Americans over 65 consume insufficient magnesium to meet established dietary reference values. The authors found that magnesium glycinate supplementation at 200 to 400 milligrams nightly reduced nocturnal leg cramp frequency by an average of 68% within 4 weeks. The test to request: RBC, red blood cell, magnesium, not just serum magnesium, which frequently appears normal even when tissue stores are depleted. Ask for it by name. The next sign involves something you look at every day but almost certainly have never read as a diagnostic signal. Sign number 3, frequent unexplained bruising, not thin skin, a vitamin C and K deficit. Urgency level, monitor. Think of your capillaries as tiny garden hoses. The wall of each hose is made of collagen, a protein that requires vitamin C to synthesize. Without adequate vitamin C, the hose wall thins. A minor bump does not rupture a healthy hose, but it ruptures a thinned one easily, releasing blood into the surrounding tissue. That is the bruise you see. If you are developing small bruises on your forearms, shins, or the backs of your hands from impacts you barely felt, and a physician has told you it is simply thin skin associated with aging, that explanation is incomplete. Vitamin C is the cofactor required for collagen synthesis in capillary walls. Without it, vessel walls become fragile and permeable. Vitamin K is essential for the clotting cascade that stops a bruise from spreading once a vessel is damaged. Adults over 60 are at particular risk because vitamin C absorption decreases with age because many common medications, including aspirin, warfarin, and corticosteroids, deplete both vitamins. and because a preference for cooked vegetables significantly reduces dietary vitamin C intake. Heat destroys a substantial portion of vitamin C content. Important, because vitamin K interacts directly with anticoagulant medications, discuss any increase in dietary vitamin K with your prescriber before making changes. The next sign connects two body parts you would never think to link, one you see every morning and one you never think to examine. Sign number 4, loss of the outer third of your eyebrow, your thyroid's quiet signal. Urgency level, monitor. Your thyroid hormone is numbered by the iodine molecules it contains. T4 carries 4 iodine atoms. T3, the active form, carries 3 after 1 is removed by conversion enzymes. Without adequate iodine, the factory cannot build the hormone, and when thyroid hormone falls below optimal levels, hair follicles throughout the body, particularly the outer eyebrow, go dormant. Stand in front of a mirror. Look at your eyebrows carefully. Is the outer third, the portion closest to your temples, thinner, sparser, or absent compared to photographs of yourself from 10 or 15 years ago? This is one of the most specific and underappreciated clinical signs of hypothyroidism in older adults. Thyroid hormones regulate the growth cycle of hair follicles throughout the body. The outer eyebrow follicles are particularly sensitive because they have the shortest growth cycle of any facial hair structure and are the first to show the effect. A 2019 study in the journal Thyroid assessed the diagnostic specificity of clinical signs in hypothyroidism across 1,200 adults over 60. Loss of the outer third of the eyebrow showed a specificity of 71% for confirmed hypothyroidism, the highest of any single clinical sign assessed. The test to request a full thyroid panel, TSH, free T4, and free T3, not TSH alone. Many subclinical cases are missed when only TSH is measured. The next sign moves from the face to the joints and connects a vitamin to a pattern most people have been told is unfixable. Sign number 5, morning stiffness lasting more than 20 minutes. Not arthritis, a vitamin D deficit. Urgency level, monitor. Synovial fluid, the lubricant inside every joint, behaves differently at different vitamin D levels. Think of it as the difference between honey at refrigerator temperature and honey at room temperature. Vitamin D directly regulates the inflammatory signaling that controls synovial fluid viscosity. Low vitamin D thickens the honey. The first 20 minutes of morning stiffness that most people accept is largely a reflection of overnight vitamin D-dependent inflammatory activity. Vitamin D receptors are present in every cell of the synovial membrane. Vitamin D directly suppresses the inflammatory cytokines that cause joint swelling and stiffness and regulates the production of lubricin, the protein that gives synovial fluid its lubricating properties. An estimated 42% of American adults are vitamin D deficient, and the rate climbs to over 60% in adults over 65. The deficiency is particularly pronounced in winter months in northern states, in darker-skinned adults at any latitude, and in adults with any degree of adiposity, because vitamin D is fat-soluble and is sequestered in fat tissue. The test, serum 25-hydroxyvitamin D. Target level for adults over 60 is 40 to 60 nanograms per milliliter, not the 20 nanograms per milliliter threshold that many laboratories still report as sufficient. The next sign involves a specific quality of tiredness that most people have accepted as their new normal and have stopped mentioning to physicians. Sign number 6, persistent fatigue after adequate sleep, when rest does not restore. Urgency level, monitor. Your cellular energy factories, the mitochondria, require a specific set of inputs to convert food into usable energy. Iron is the oxygen-carrying molecule that delivers fuel to the factory. B12 is a cofactor required to run the production line. Without either, the factory receives raw materials but cannot process them efficiently. You eat, you sleep, but the energy output remains insufficient. That is the fatigue that sleep does not fix. There is a specific quality of fatigue that is distinct from tiredness caused by poor sleep. It is a flatness, a low ceiling on available energy that persists regardless of how many hours you slept or how little you did that day. You wake up tired. You remain tired through the morning. Iron is required for hemoglobin synthesis, the oxygen-carrying protein in red blood cells. Without adequate iron, your blood delivers less oxygen to every tissue. B12 is required for the production of red blood cells themselves. Without it, the cells that form are large and dysfunctional, unable to carry oxygen efficiently regardless of iron status. Adults taking PPIs for acid reflux have a particularly elevated risk of both deficiencies simultaneously, because stomach acid is required for both iron liberation from food and intrinsic factor production. The protein needed to absorb B12. A landmark review in the New England Journal of Medicine estimated that 10 to 15% of adults over 60 in the U.S. have frank B12 deficiency, with subclinical insufficiency affecting up to 40% of the population in this age group. The authors recommended methylmalonic acid as a more sensitive confirmatory marker than serum B12 alone. The test to request serum ferritin, not just hemoglobin, serum B12 and methylmalonic acid. If your B12 appears borderline normal but MMA is elevated, functional B12 deficiency is present. Sign number 7. Intense craving for salt, your adrenals sending a sodium signal. Urgency level, monitor. Your adrenal glands produce a hormone called aldosterone whose primary function is to regulate sodium balance in the body. When sodium levels fall, aldosterone rises, signaling the kidneys to retain salt and instructing the brain to increase salt-seeking behavior. A craving for salty foods that feels compulsive and arrives specifically in the late afternoon or evening is frequently aldosterone communicating that sodium stores are low. If you find yourself reaching for salty crackers, chips, or pretzels, specifically in the late afternoon or evening, even after eating a reasonable meal, your adrenal sodium axis may be signaling a genuine deficit rather than a habit-driven craving. Sodium deficiency produces fatigue, muscle weakness, and cognitive slowing that closely mimic aging. Many older adults on strict low-sodium diets, particularly those also taking diuretics, are operating in a state of mild chronic hyponatremia that their physician is not actively monitoring. What to assess? A basic metabolic panel including serum sodium and potassium. If you are on a diuretic and a low-sodium diet simultaneously, ask your physician whether your electrolyte levels have been checked recently. Now, sign 8, the one Margaret almost never mentioned. Sign number 8, tingling or numbness in hands and feet, the most mislabeled sign in American medicine. Urgency level, act today. If you have tingling, numbness, or the sensation of walking on a surface that is not there, in your feet, your toes, your hands, or your fingertips, and a physician has told you it is peripheral neuropathy from diabetes, from aging, or from poor circulation, I need you to hear this very carefully. That may be true. But in a significant proportion of Americans over 60, peripheral neuropathy is caused or substantially worsened by B12 deficiency. And the damage it causes to the myelin sheath surrounding peripheral nerves is progressive, cumulative, and in its early and middle stages, reversible with adequate B12 repletion. Now let me tell you what I promised you at the beginning. Every peripheral nerve in your body is wrapped in a layer of insulation called the myelin sheath. Myelin is what allows nerve signals to travel at the speed they need to. Without it, signals slow, distort, or fail to arrive. The tingling and numbness you feel is the sensory experience of impaired myelin function in the nerves supplying those areas. Vitamin B12 is a required cofactor in the synthesis of myelin. Without adequate B12, the cell machinery that builds and maintains myelin cannot function. The sheath begins to thin, first in the longest nerves, which is why the feet and toes are affected before the hands and fingers, then progressively upward as the deficiency deepens. Here's the clinical fact that changes the urgency of this finding. In the early and middle stages of B12 deficiency neuropathy, before significant structural nerve damage has occurred, the process is substantially reversible with aggressive B12 repletion. Patients who receive intramuscular B12 injections within the first 12 to 18 months of symptom onset show measurable improvement in nerve conduction and subjective symptom reduction in the majority of cases. Beyond 24 to 36 months of progressive deficiency, the structural damage to the myelin sheath becomes increasingly permanent. The tingling may persist, the numbness may deepen. The window for full reversal narrows with each passing month. Margaret had been experiencing tingling in both feet for 8 months when I first saw her. Her primary care serum B12 had been 220 picograms per milliliter. Technically within the laboratory's normal range, which starts at 200, her methylmalonic acid level was elevated. Her functional B12 status was deficient at a cellular level that the serum test had missed entirely. She received intramuscular B12 supplementation over 6 weeks. At her 3-month follow-up, the tingling had reduced by approximately 70%. Her fatigue had also substantially resolved. Her leg cramps, addressed simultaneously with magnesium glycinate, had stopped within the first month. None of this was aging. All of it was correctable. The barrier was the label that had been placed on it, and the absence of the right test to challenge that label. A 2017 prospective study in Neurology followed 89 patients with confirmed B12 deficiency peripheral neuropathy who received aggressive supplementation therapy. Among patients treated within 12 months of symptom onset, 74% showed significant improvement in nerve conduction velocity and subjective symptom scores at 6 months. Among patients treated after 24 months of symptoms, only 31% showed comparable improvement, demonstrating a statistically significant window of reversibility that narrowed with diagnostic delay. The test to request, in order of priority: serum B12, methylmalonic acid, and homocysteine. If MMA is elevated with borderline serum B12, functional deficiency is present regardless of what the laboratory range suggests. Intramuscular B12 bypasses the absorption deficit entirely, and particularly important if you take PPIs or metformin. Do not wait for your next annual physical. If you have tingling or numbness that has been present for more than a few weeks, call your physician's office this week and ask specifically for serum B12, MMA, and a peripheral neuropathy evaluation. Name those tests by name. The difference between catching this in the reversible window and missing it could be measured in years of neurological function. I want to hear from you before you move on. Which of these 8 signs are you currently experiencing? Write it in the comments below. Be specific. Leg cramps at which frequency? Tingling in feet only or hands too? Morning stiffness for how long? And tell me your age, because the prevalence and urgency of each of these signs shifts meaningfully across the 60s and 70s. And I want to calibrate the next video precisely around who is in this audience. If you found yourself on this list, and as I believe most of you did, subscribe, because what I am covering next connects directly to everything in this video. The specific medications most commonly prescribed to Americans over 60 that are actively depleting the nutrients we discussed today. Your physician is prescribing them appropriately for your diagnosed conditions, but the nutrient side effects are rarely communicated. That video changes what questions you bring to your next appointment. One more thing before you go, and this directly affects every sign I showed you today. There are 6 medications prescribed to more than 40 million Americans over 60 that directly deplete the exact nutrients we discussed in this video: magnesium, B12, vitamin D, zinc, and potassium, all depleted by drugs your physician considers standard of care. The depletion is documented in the medical literature. It is almost never communicated to the patient, and it means that for millions of older Americans, the signs I just showed you are not the result of poor diet. They are the pharmacological consequence of the prescriptions sitting on their nightstand. That video is on your screen right now. Watch it before you take your next dose. What you find there will not tell you to stop your medications. It will tell you what to monitor, what to test, and what to supplement. So the treatment does not quietly create the problem it was prescribed to solve. I will see you there.